You are ready to get that baby out of you and you're wondering, what can I do to do it? And you're looking online, you're seeing all these people jumping around and you're wondering, can jumping jacks put me into labor? Today we're going to talk about if they can put you into labor, what else you should expect from jumping jacks, and just anything else to think about jumping a lot when you are pregnant. Let's get started. And as a reminder, here at the Pregnancy Nurse, where we get you prepared, not scared for your upcoming birth, all of this comes from evidence-based, plus my experience in the labor and delivery rooms for 20 years, and Hillary being pregnant for 3 babies, including one that was 12 days overdue. So I 100% totally understand wanting to go into labor, but I gotta give a word of caution about jumping jacks. And first off, I wanna tell an immortal truth. There's a big difference between pain and labor. And I think a lot of people get them confused. There's a lot of these things that people think will put them into labor that really just produce pain. They aren't pushing baby down into the birth canal. And as a reminder, what you're wanting to do is to get this baby into the birth canal, not just for your uterus to contract. And I think a lot of people get confused on that one. So that's the first thing that we want to start with. And I'm also here, what other things are you wondering if they'll put you into labor? Tell me down in the comments because I would love to make videos about those as well. Okay, so why might jumping jacks or just bouncing in general, say the trampoline? I see pregnant ladies on the trampoline. Oh, please don't. The trampoline, for a nurse, it's like a nightmare. But why would jumping put you into labor? Well, I mean, there are things that we're doing that are similar to jumping. So we encourage you to move a lot. Walking. I think even curb walking can be helpful. And a lot of people will think, well, if curb walking is helpful, why not jumping jacks? And honestly, there really is no evidence about curb walking. I don't know who's going to make a study about that, but there's definitely no evidence about jumping jacks putting you into labor. And as a nurse who sees patients who come into triage, I have seen negative effects of jumping jacks when you are pregnant. The first one being that a lot of people's bladder just cannot take all that amount of jumping. So you might end up wetting your pants, and nobody wants to do that. Now, sometimes you're going to cough or sneeze or laugh really hard. You're going to wet your pants that way, but jumping jacks are easily preventable. I'm going to tell you that most of the week, I easily prevent jumping jacks from happening at my house. But as you jump, those jumping jacks are just putting so much strain on your round ligaments that hold your uterus into your body. Remember, here's your uterus. And at certain areas, it like ties off into your body with the round ligaments. There's other ligaments as well, but usually it's the round ligaments who really make themselves heard through ligament pain. Now, I have a whole video on ligament pain that I'm going to link to up above and down below. If you're wondering more about ligament pain, definitely something to look into. But because you're jumping, those ligaments really get stretched and very ornery. Not in the mood for that. And finally, you might hurt yourself doing jumping jacks. It just increases your chance of falling or, injuring a ligament on the other parts of your body. And we don't want that in the end of pregnancy because it's just going to make everything so much harder. So between wetting your pants, making your ligaments upset, and the possible chance of hurting yourself, I'm not a fan of jumping jacks. And in fact, I have never seen jumping jacks putting people into labor because most often people don't love doing jumping jacks. And remember, when you are going into labor, your brain, your uterus, and the baby all have to agree that it's time to start labor. Now, sometimes that goes off the rail with preterm labor and things like that, but your brain needs to know that you're in a safe place and you're ready to start labor. And my brain does not think I'm in a safe place when I'm doing jumping jacks, I'm pretty sure, especially if I'm pregnant. So, I think it's one of the ways to maybe stop labor. Take that for what it's worth. Now, a lot of people use their yoga ball and they just bounce on it. And honestly, the same thing. I think that there can be nice ways for baby to slide into your pelvis. But again, all that bouncing is just going to make those ligaments upset. Instead, you want to do sexy hip circles on that yoga ball to give that baby their opportunity to find their best way down into the birth canal without making your ligaments upset. So movement, especially movement in different ways, side lunges, forward lunges, and I'm not talking that you need to do the full lunge like you might have done before you were pregnant. Just getting into a place where it feels comfortable can be helpful in baby finding their best way into the birth canal and also loosening up those ligaments into new ways that you don't always have when you're laying on the couch or sitting at your office chair. Movement is good. Jumping jacks, maybe not so good. Now let's just pretend, no, Hillary, I'm going with the jumping jacks. I always recommend discussing it with your provider before you try something. at the end of pregnancy, you're seeing your provider almost as much as you see your partner, I feel like. So just bring it up at your appointments. Hey, I'm going to try some movement like jumping jacks just to see if that can start things. That way your provider can give you information based directly on you on if that's a good idea or not. Now, some of you, it might be an absolutely fine idea. So your provider's going to be like, sure, you're a young, healthy, very active person. I think that's going to be fine. Versus, an older person who maybe has never done a jumping jack in the last year, maybe shouldn't be doing jumping jacks at all at this point in time. And finally, you just don't get a pick when you go into labor, unfortunately. I feel like the internet has made people feel like there is something that they can do that will put them into labor. Well, there is, but it is an induction in the hospital. Those are the methods that have really been proven to be safe to put you into labor versus jumping jacks. Remember, pain is not the same thing as labor. Movement is good. Make sure you talk with your provider before you're doing something to put you into labor. I think it's going to really be helpful as you move forward. Now, I do have a whole video of things that have been proven to help soften your cervix. I want you guys to check that one out. Now, what else are you trying to decide if it's a good idea to put you into labor? Let me know down below. Maybe I can do a video on fact checking those as well. Thanks for joining us here at the Pregnancy Nurse, where we get you prepared, not scared for your upcoming hospital birth.